Hello everyone, myself Ritika Belsare from B.Pharm second year, and today's my topic for presentation is Haemophilus influenza, which is guided by Professor Suhani Solanki ma'am. Topics to be covered in my presentations are introduction, common and scientific name, history and morphology of influenza, pathophysiology of influenza, signs and symptoms of infection, clinical features, treatment available, prevention and reference. Introduction. What is it? Haemophilus influenza are the common bacteria that cause a wide variety of infection in children. Type B has been the cause of the most serious disease but can effectively prevent by immunization. Other type of H flu, especially non-typeable H flu, remain very common. Not long ago, Haemophilus influenza type B, that is also called as HIB, was the number one cause of the bacterial meningitis. Common and scientific name: Haemophilus influenza, formerly called Pfeiffer bacillus or Bacillus influenza. Scientific classification: domain bacteria, kingdom Eubacteria, phylum Proteobacteria, class Gamma Proteobacteria, order Pasteuriales, family Pasteuriaceae, species Haemophilus influenza, and genus Haemophilus. History and morphology of influenza. The genus Haemophilus contain many species, but Haemophilus influenza is the most common pathogen. It was first described by Pfeiffer in 1892 during an outbreak of influenza. It is also called Pfeiffer's bacillus. The organism was then given the name Haemophilus by Winsome et al. In 1920. In 1933, Smith et al. Established that influenza was caused by the virus and Haemophilus influenza was caused by the secondary bacterial infection. Secondary bacterial infection is during or after the treatment of the infection. Influenza appear as large, round, smooth, convex, colorless to gray, opaque colonies. It is gram-negative bacterium. Haemophilus influenza is the fastest growing bacteria, but most suitable temperature is 35 to 37 degrees Celsius. It is non-spore forming, non-motile. Here are some images of Haemophilus influenza. Pathophysiology of influenza. Mode of transmission. Haemophilus influenza disease is the name for any infection caused by bacteria called as Haemophilus influenza. The one of the people are most familiar with Haemophilus influenza type B or HIB. Haemophilus influenza are often cause ear, eyes or sinus infection. They also cause pneumonia. This bacteria lives in people's nose and throat and usually cause no harm. However, the bacteria can sometimes move to other parts of the body and cause infection. Experts do not know how long it takes after Haemophilus influenza enters a person's body for someone to get sick. However, it could take as little as few days before symptom appears. In short, it took time to show its symptoms. How it affects human physiology. Population on most at risk: infants and children 5-year-old and younger, elder 65-year-old and older, people with certain medical condition, sickle cell disease, spleen, no spleen, HIV infection, antibodies and complement deficiency syndrome. It is a rare condition that affect the body's ability to fight infection. Cancer requiring treatment with chemotherapy, radiation therapy or bone marrow stem cell transplant. Signs and symptoms of this infection. There are three most common symptoms, that is pneumonia, which has fever, chills, chest pain, cough, difficulty in breathing. Bacteremia. Bacteremia, it is the condition in which the presence of viable bacteria occurs in the circulating blood, which cause fever, chills, abdominal pain, vomiting, diarrhea, nausea. Meningitis, which cause fever, headache, stiff neck, altered mental status, confusion, fatigue. Some common cause of ear infection in children and bronchitis in adults. Here are some images of this infection. Clinical features. Haemophilus influenza can affect many organs and cause many different type of infection. That is type B HIV cause meningitis, brain, epiglottis, windpipe, pneumonia, lungs, arthritis, joint, cellulitis, skin, osteomyelitis, bone, bacteremia, blood. And not non-typable cause is otis media infection, bronchitis, or sinusitis. Treatment available for this infection: drug of choice ampicillin, chloramphenicol, third generation cephalosporin, example cefotaxime and ceftriaxone. Treatment course is usually of 10 days. Many isolates of Haemophilus influenza can cause beta-lactamase. Beta-lactamase, it is the enzyme produced by bacteria that provide multi-resistance to beta-lactam antibodies. Ampicillin resistant strain of HIV are now common through US. In most medical centers, 25 to 30% of HIV are now resistant to penicillin and ampicillin. In some medical centers, 50 to 60% of HIV isolates are ampicillin resistant. If beta-lactam positive, cefotaxime becomes the drug of choice. Prevention: HIV vaccine is recommended for all children younger than 5 years of the age in US. Vaccination can prevent Haemophilus influenza type B HIV but not other type. HIV vaccine can prevent meningitis, epiglottis and other infection caused by HIV bacteria. HIV vaccine is usually given to infants starting at 2 months of age. Here are some references. Thank you.